Today we have completed our first class of virtual reality surgical training in trauma. We discussed, we practiced, and we learnt about proximal femoral nailing in intertrochanteric fracture. We learnt about distal radius fracture, closed reduction and pinning, and we also did distal femoral nailing for a distal diaphyseal fracture, all in virtual reality. We had 8 candidates today who had come from different institutions from Delhi NCR. Our mentor faculty was Dr. Pushkar Chawla, who is the senior consultant trauma and orthopedic surgeon.
And मेरा बेसिक कंसेप्ट इसमें आने का ये मतलब है यार ये एक टेक्नोलॉजी है जो आएगी ही.
Why we need this training in orthopedic surgical skill in virtual reality? What's wrong with the conventional method through which we all have come out? Since I have also been a postgraduate, a fellow, a resident, a registrar, like many others, I know that there are many flaws in the training system. The training system is no doubt very unique and the need of the learning curve. So virtual reality orthopedic surgical training system is something which I would call out of the box. You learn a surgery without any cost, without any threat, without any danger to the patient. You are allowed to do mistakes. You are allowed to take multiple attempts while doing a procedure.
बेटा जो बोर्ड आ रहा है सामने है उसको पढ़ो. क्या लिखा हुआ है उसमें? रख दो 100 को वापस. Keep it on the table. Release your ears.
There is no restriction of time. There is no fear of blood loss. There is no time constraint. In fact, the entire philosophy, the entire process is to allow somebody to do mistakes at nobody's cost.
अब इसको यहीं पे रखा, इस हाथ से सियाम चेक किया, सियाम चेक करने के बाद स्क्रीन पे देखा, इज इट ओके? फिर आपको चेंज ओवर करना है तब आपको आगे पीछे करना है. जो उसकी कमियां हैं मोस्ट प्रोबब्ली इज ट्राई टू कवर इट अप देयर कि यू चेक आउट द बोन. लाइक हम बोन को फील करते हैं और रेडियस साइड को फील करते हैं, एनाटॉमी को ऑब्जर्व करते हैं. सो वो उसने डालने की कोशिश किया व्हाटएवर ही कैन. जब आप स्टार्ट करें तो आपके हैंड कंट्रोल मूवमेंट्स बेटर होगा. आपका जब डालते हैं जो आप स्किन में पियर्स करते हो तो कुछ नहीं होता. जब आप बोन में ड्रिल करते हो तो यू फील दैट वाइब्रेशन जाते हुए में. जैसे आप छोड़ते हो तो फिर लूज होती है. तो वो कंट्रोल हमारा फिजियोलॉजिकल आए.
So virtual reality orthopedic surgical training is a unique platform which gives even a junior fellow as junior as first year postgraduate to a senior orthopedic surgeon as senior as 20 years post graduation to practice and learn new surgeries. I invite you all to get the hang of this technology, learn as much as you can, make as much as mistakes as you want, do as much as experiment as you want to do in your surgical steps without any cost to your patient. Thank you.